talk to us a little bit about what has been the slow progression of the rollback of the rights of the pharmacist to compound medications that patients need.
Right. So that's a good point to actually make from the standpoint of medical freedom, because everybody is, again, not the same in the sense of how they're going to react to certain medication, nor are they end up having to be the same in terms of their conditions and everything else. And that kind of brings you to a point in terms of bioidentical hormone replacement therapy, because everybody's needs in dealing with, especially for female patients and also men, have different needs in terms of different types of hormonal issues. One thing is that we all have to think about how to customize it based on, what you're suffering from. Nothing cannot be done in a cookie cutter approach. And this is where a lot of times the government entities end up having to say that because they don't have the full control over the manufacturing process, or even the so-called rigorous approval process, that they cannot say these are safe to be done. And that was the main issues that end up having to be done based on the issue that's coming up right now, where there was a large cohort study done reviewed along by the National Academy of Science and Engineering and Medicine, where they looked at overall the compounded bioidentical hormone replacement therapy and how that ended up having to be proven to be safe, as well as how effective it was. So the issue behind that is that the government entity, I'm not sure if I could say FDA or not, but that's what it comes out to. They looked at this. They didn't include any of the experts in terms of like myself, or even the physicians who are doing these bioidentical hormone replacement therapy, nor did they end up having to listen to any of the patient standpoint and having to see limited data. And they end up having to conclude that unless the patient is actually allergic to some of the manufactured products, that they should not be utilizing compounded products at all. And that there has to be some type of special documentation to go through. That's going to really limit in terms of the current millions of female patients that are being taken care of using bioidentical hormone replacement therapy. And so that's a real danger. And that's going to really be an issue in dealing with a lot of patients out there. Not even just that, for them to get access on, it's going to be limited, as well as you can't customize a lot of the therapies. Because again, not everybody's the same. Not everybody cannot be fitting into that whole cookie cutter approach and thinking that's going to be working with it.
So when we think about drug research in general, Lara Zakaria and I have talked on the podcast about how damaging. Yeah, she is so smart and just such a go-getter, and just really gets what pharmacy can be. And she and I have talked a lot about how skilled pharmacists are in researching and analyzing drug literature, and how, for some reason, we're never included in the discussion. And it mimics what you were saying, which is like, wait a minute, if you want to make a decision about the safety and efficacy of compounded bioidentical hormone products, you need to talk to a pharmacist who compounds bioidentical hormone products. Why do you think that pharmacists are so often left out of the discussion? And then all of a sudden we have these new rules, these new regulations that govern our scope of practice, when it's like, wait a minute, no, I didn't vote on that. I didn't have any input on that.
I think it's a lot of times there's a biasness that comes from the government officials. That's just my personal opinion. Everybody could say differently, but I think there's a lot of biasness. As a result, I mean, just to take, for instance, I'm not sure if you're aware of the compounded meningitis outbreak that actually occurred back in 2012 with the tainted vial of dexamethasone by a compounding pharmacy up in Boston. Same thing with that issue alone. Obvious reasons, these are rogue pharmacists that were not doing things properly. And by all means, the government entity like FDA should have came in and then really shut that operation down, but they didn't do that. They let that problem to go through, and then we actually had that type of incidents where 60 people end up having to die from the meningitis outbreak from these particular tainted vials of medication that were compounded by a pharmacy up in Boston. So following that aspect of it, the DQSA, that particular bill that was passed by the Obama administration, ended up having to put a lot of stranglehold in terms of what could be done and what could be compounded, and in terms of what pharmacists could do. By all means, I'm for regulation. The issue behind this is that pharmacists, especially compounding pharmacists, were never invited to the table to discuss this freely. Right? There are a number of compounding pharmacists, including myself. I own a compounding pharmacy. I've been doing compounding for the last 15 years. And there are rules and regulations that we have to follow, as well as safe practice that we have to do to ensure safety is one thing, but then also bring forth a high quality compounded products to the patients. So these are the measures that we end up having to bring forth to the table, but we were never invited.
Mm-hmm.
And right now, even that particular standpoint in terms of having to invite a compounding pharmacist, myself and my other colleagues end up having to go to Washington to talk to our lawmakers to recommend one of the compounding pharmacists to be in that table to have a discussion freely with the governing bodies. So that's not being done, because if we end up having to bring a different form of communication or different standpoint, that's not the actual agenda they want to push through. And totally what they want to do is put an ultimate control in terms of what's available and what should be allowed. And that's even goes with the whole PHRT argument right now.
Which is supremely frustrating, because pharmacists are excellent at compounding medications and ensuring that you not only get the right drug, but like you said, that it's a high quality product. And you know, I'm not naive. You're not naive. Of course, there are bad pharmacists out there that just don't care. There are bad physicians. There are bad chiropractors. There's no profession that is perfect. But to make decisions about the practice of pharmacy without a pharmacist at the table is inherently not informed. You know, we have a lot of discussions right now about how important it is to get diversity at tables, because when we don't have people of color, or we don't have people with different socioeconomic backgrounds at the table, we miss some of the things because we only have one perspective in this world. And so a lot of people, I don't know if you've watched The Social Dilemma yet, but this
I haven't done that yet.
Oh, it's terrifying. It will scare the bejesus out of you.
Definitely to watch.
But this year has definitely been a very strong year as it relates to censorship about alternative medicines, alternative therapies. I personally have been told that I've been spreading misinformation, and I'm like, this is an article that's published in JAMA. Like, I don't see how you think that is misinformation to say that vitamin C and vitamin D status matter when it comes to the function of your immune system. So why do you think there is such an attempt to censor alternative medical treatments online?
In doing this, I think there's a lot of lobbying groups that goes on in Washington from the payer standpoint, as well as payers, meaning insurance companies, as well as in dealing with manufacturers. And obviously these are big lobbying groups. They spend billions of dollars, end up having to talk with their lawmakers and making certain policies that end up having to benefit them. But the main cases, you know, just like compounding pharmacists, you know, we are basically considered to be the rogues that they cannot control.
Mm-hmm.
And they don't want that kind of lack of control they have. And so these are the measures that end up having to come forth to blockade some of the informations, also leaving off the, you know, main standpoint in terms of, you know, pharmacists getting into the discussion, but then also in dealing with the whole COVID-19 that's happening right now, it matter in dealing with alternate medicines, such as using vitamin D, C, or even just any other immune supporting products are not popular because, again, it doesn't make the big bucks by the big pharmas out there. You know, by all means, I mean, these are the things that end up having to be the main points, that why are we not discussing about this? Why are we not end up having to put this discussion into the forefront for public health, rather than trying to scare people to be locked in their house and not having to have the adequate amount of control in their health? And these are the main things that I want to make a change on. And so as yourself, in dealing with patients having the rightful choice. And again, kind of stems all back into having the medical freedom to take care of yourself. Because I strongly believe that doctor of the future is you.
Mm-hmm.
In the main sense of it. It's not the doctor who's, working at some kind of fancy office or a hospital. Ultimately, that choice in terms of how you take care of yourself is based on the patient standpoint. And I strongly believe, in terms of what's happened with the COVID-19, there's a huge paradigm shift of people want to really control their overall health, preventative cares, and being healthier. And even the standpoint, there's a popularity going on with the word wellness, that people want to be well and to take care of themselves because they want to have a full control of it. They don't want to be locked down like this. And this is the main point that I'm having to do. And I strongly believe that this was a blessing and in disguise, having to have this kind of incidents where now people are waking up and now realizing that they have to stand for medical freedom.